Now, you already lost all your molars. We don't have no anterior teeth. You still have some canines, but those canines start to have some periodontal disease, some movement, and it's time for you to make that big change. This is very interesting because you don't know how many patients they go through this. They go to see a doctor and they say, okay, my friend, now you're ready for dentures and you're a perfect candidate for dentures. Well, here I'm a little bit skeptical about this because once you have this, no teeth, bone was intended to be loaded, but now there's no teeth, so the bone starts to shrink. But doctors then tell you, hey, I'm going to make a beautiful denture. Actually, I'm going to make a printed denture. I'm going to make something with high-tech denture. Doesn't matter. It's a denture. At the end, it's going to be a denture. If it's going to be like we call it the traditional denture, we're going to take an impression. If we're going to do a digital denture, you're going to scan. And at the end, this is like a puffy tissue. So at the end, you need to adjust it. It's the same story. It's the same story. The difference is that once you have your denture, probably your doctor, and if your doctor doesn't tell you that, please do your homework and search for another doctor, because doctors need to tell you, hey, what is going to happen is that I'm going to give you a denture for now. To all my patients that they have dentures and they ask me on social media, dentures are good, but they don't tell you nothing about the bone. What happens with the bone? That bone is going to be more softer bone, okay? And also, it's going to start to shrink. As I already said in other videos, it's going to be vertical and horizontal. So you're going to have your denture. Yeah, but I have my denture for 5 years, for 10 years, for 20 years, and I just go for relines and they make a new one and I have 2 sets and I have blah, blah, blah. It's the same story. What happens with the bone is that whenever you think to put an implant there, the bone is going to be rather soft, or the bone is going to be thin, or the bone is going to be like a muddy bone. There's no way to put implants there. That's the hardest thing there. So then you're thinking, hey, I'm still wearing dentures, but you know what? In a long-lasting term solution, dentures is not it. It's something that you're going to be having that denture falling down. Doesn't matter how much glue you're going to put on that. Doesn't matter. At the end, it's going to be a denture that is going to get loose because here, the bone is going to continue shrinkage. So placing implants is good. Which technique? We're going to talk about that in other videos. But right now, just to understand, if you don't put implants once you extract your teeth, you're making the biggest mistake in your life, because this is going to continue. And we call it the very slow process of destruction, of self-destruction. Hope this video helped you and take your decision for implant dentistry. Find out a doctor that can explain you what's going to happen, the pros and cons, but also what could be the advantages with implants inside your mouth when you start to lose your teeth and you become an edentulous patient. I am Dr. 𝐿𝐶, Diplomate of the American Board of Oral Implantologists, the ABOI. Thank you. Bye.